everyone, for being with us today. My name is Joyce Taylor. I am the Executive Director of the American Heart Association Central Arkansas office. And we are so glad that everyone is joining us today and to start our community conversation webinar series on senior health. So the mission of the American Heart Association is to be a relentless force for a world of longer and healthier lives. And frankly, Arkansas could use some improvements. So we are extremely delighted to be partnering with the Community Health Centers of Arkansas and our local sponsors, Saline Memorial Hospital and CHI St. Vincent as well, and helping get this important messaging out. Data from the CDC shows that life expectancy in Arkansas at 76 years. That is 5 years shorter than Hawaii, which has the longest life expectancy. 5 years. So imagine how many memories can be made in 5 years. How many treasured moments can happen with friends and family. And that means that someone would miss out on that, but then our family would miss out on us as well. So that is quite extraordinary. Arkansas also ranks third in the nation for heart disease deaths. We are tied third for adults who are obese and fifth in the nation for adults with hypertension. While this data is quite troubling, there is good news as well. Healthy steps at any age can make a big difference in someone's lives. All age groups, no matter what age, can benefit from healthy choices. A study published in 2018 found that 50-year-old women who engaged in five low-risk factors lived an average of 14 years longer. 14 years longer. Those factors include never smoking, exercising for 30 minutes a day, having a normal body mass index, eating a healthy diet, and consuming a moderate level of alcohol. Ladies, no more than 1 for us and 2 for men. Age does increase risk for heart disease, with blood pressure, cholesterol, and other numbers trending to increase. Watching numbers closely and managing any health problems can help a person live longer and better. We're so glad that everyone's joined us. We're glad we're filming today. Please invite your friends and family to join and hear this great information as well. We will be able to look back, and we're going to be posting all the recordings this week, and those will be on social media. So you'll be able to look back. If you missed anything, you can rewatch something, but you could also share these out with family and friends as well. So this is good for everyone, no matter what your age. So important information. And I am so very happy to turn it over now to Jeannie Otts and let Jeannie introduce herself and provide our presentation for today. So Jeannie.
All right, thank you very much for having me today. I have worked with the American Heart Association this past year and enjoyed the work and the how they're committed to Arkansas and to making us a healthier state, top to bottom. So thank you so much for what you do. Thank you for your leadership in this. And we're going to talk today about senior care and cardiovascular disease. As Joyce has said, you know, we have heart disease here, but I'm going to focus today on the senior care and things that we can do as a healthy lifestyle. I'm going to do some definitions. I'm going to, you know, let you know what to look for. We're going to talk about some early heart attack care. So I'm going to get into this right now. Next slide, please. So tell you a little bit about myself. I am the director of the cath lab here at Selene Memorial Hospital. I'm also the chest pain coordinator here. I'm a radiology technologist who is registered in cardiovascular intervention technology, which means that I am registered to work in the cardiac cath lab and the interventional cath labs, where we do the angiograms and the interventions for cardiovascular disease. My areas of interest, of course, are cardiovascular interventional service, non-invasive cardiac cath lab, where they do the echoes, and they do some of our ABIs, the ankle brachial indices for peripheral diagnosis of peripheral vascular disease. And we work with our interventional radiologist and do procedures as well with them outside of the heart. I was trained at Baptist Health School of Radiography, and I have been doing this. This will be my 30th year, and it's something that's very near and dear to my heart. All right, so we can go to the next slide. Selene Memorial Hospital has recently achieved our American College of Cardiology Chest Pain Center accreditation. I'm so proud of this facility and the work we did to pull together and to get this achievement. We are just so excited about it, and we are making a difference in our patient outcomes when they come in and when they leave us, and we are tickled pink about this. Next slide, please. I also want to talk about our cardiologists. We have Central Arkansas Cardiology Associates here at Selene Memorial Hospital, where we do general cardiology. They focus on cardiovascular disease, preventative cardiology, interventional cardiology, and peripheral vascular disease, not just identification, but treatment of that. And Dr. Jeff Stewart is our cardiologist that is on staff here, and we will also be bringing in Dr. Skinner in 2021 to join this group. And we also have Dr. Hatch with Selene Heart Group as well. So some strong cardiologists. We're really working with our community to get this information out and make sure that we're taking care of them and doing the best we can with them. So next slide. So today I'd like to talk about what is cardiovascular disease. Well, cardiovascular disease is actually a group of disorders of the heart and blood vessels, whether it's the heart to your heart vessels, the vessels to your brain, or to the other vessels in the body. It's everything joined in. Some of the disorders that that most people are familiar with is hypertension, coronary artery disease, which is where, you know, people have their heart attack or they have blockages in their arteries that we have to open up with a balloon or stent. Some people have to have surgery to correct that. We have cardiovascular disease, cerebral vascular disease, where we are talking about strokes, heart valve disease, arrhythmias, which is the electrical part of the heart, where people have arrhythmias that need to be treated. And we have peripheral vascular disease. Next slide, please. So before we get started, Joyce gave us some numbers, but when I got to looking at this and thinking about how many people are affected with this, there's an estimated 85.6 million Americans with one or more types of those disorders that we just spoke with. And 43 million of those people are 60 years of age and over. And it says, I got some information where it says that 2/3 of the cardiovascular deaths occur in people equal to or greater than 75 years of age. So those are some really big numbers and staggering numbers. So what can we do to change that? Well, the first step is reaching out and getting some diagnostic testing and then treatment of those things. I want to go over some of the diagnostic tests and surgical procedures and medications out there. One, it can be as simple as an electrocardiogram. You see a picture of the EKG strip there. There's non-invasive stress tests that you can have done. You can, depending on what you find on those, we may have to go and do the coronary angiogram. We may have to do the peripheral angiograms. Once we have done those diagnostic tests and the physician has seen what's going on, then we can decide, how do we treat this? Where do we go from here? And there's 3 different treatments: medical management, percutaneous intervention, and of course surgery. And you know, surgery can be anywhere from the coronary artery bypass, valve surgery, or the peripheral artery bypass. We can also do coronary interventions on both of those. So there's lots of options out there for treatment. It's just important to know what's going on with your body, and when your body's talking to you and telling you, you know, something's not right, to reach out and get help. Next slide, please. So what can you do to prevent coronary vascular disease? Well, one of the big things that comes up is control your blood pressure. High blood pressure is a major risk factor for heart disease. It's important to get your blood pressure checked regularly, at least once a year for most adults, and more often than that if you have high blood pressure. I know that there's a lot of places where you can go and you can get the little portable blood pressures that you can have at your home. That's very good to check and watch and manage your high blood pressure if you've been diagnosed with that. You know, you got to take steps, and we're going to talk about some lifestyle changes. We're going to go over some things about that, but that's a big thing is how do you live? What do you do day to day to help control that blood pressure? Keep your cholesterol and triglyceride levels under control. High levels of cholesterol can clog your arteries and raise your risk of coronary artery disease and heart attack. Again, lifestyle changes and medicines, if needed, can lower your cholesterol. We're going to see a theme in here as we're going through these different things that we can do. It all comes down to lifestyle changes, and that's really what I want us to talk about, because until we change our lifestyle and we have a healthier a way that we live, we're going to have to fight these things that we're talking about rather than control them and prevent them. Next slide, please. Healthy diet and weight. Stay healthy. Stay at a healthy weight. Ms. Joyce will give you your BMI and control of that. She had mentioned that being overweight and having obesity can increase your risk for heart disease. You need to eat a healthy diet and try to limit your saturated fat, sodium, sugars. Eat plenty of vegetables, fresh fruit, and whole grains. But the big thing is to get out there and get active. Get that regular exercise. You know, you need to at least be out 30 minutes 3 times a week. And, you know, you think, well, what can I do? And, you know, join a gym, it's expensive. These are very simple things. It's just getting out there and exercising for 30 minutes to get that heart rate up, whether it's walking, jogging, doing some interval stuff. And we want to make sure that you bring in some light weights and resistant bands to achieve that muscle tone, because that will only make you stronger and help to fight this heart disease and to prevent it at that point. Next slide, please. We see a lot of diabetics in our state as well. Diabetes is prevalent. So that's something that needs to be managed. Having diabetes doubles your risk of heart disease. That is such a big thing to think about, and how it doubles that. As I've been in the cath lab for years, when I see someone's, I can almost look at the vessels on a coronary angiogram and know that that person has diabetes. That's the type of effect it has on a person's arteries. And so it's so important to get tested for diabetes, identify that you have it. Then once you have it, do everything you can to keep it under control with medications, diet control, exercise. I'd like to, you know, my daddy, who is 72, he was diagnosed 2 years ago, it may have been 3 years ago, with diabetes. And he took it as, I'm gonna get with this. He was on medication for a bit, but through exercise and change of lifestyle, he now is off of his medications, and he knows the importance of staying active. His activity to help beat this diabetes was was cycling. He got on a bicycle and he rides at least 5 times a week. So there's things that you can do to get out there and to manage these, and limit your alcohol. Drinking too much alcohol can raise your blood pressure. It adds calories. There's just limit that alcohol. Don't smoke. Cigarette smoking It's bad for your heart, your lungs, it's bad for your skin. There's just so many things that cigarette smoking can do to your body. So but most of all, it gives you at a higher risk for heart attack and stroke. So please be careful with that. Put those cigarettes down, get help. There's so many smoking cessation programs out there that can help, that your primary care physician has access to, or if you have a cardiologist, speak with them because they can get you on a program. It's very important. And also, I talked to you about managing your stress. Stress is linked with heart disease in many ways. It affects your blood pressure. Stress can take away from you getting out and being active. There's just many things that stress affects your body negatively. So try to manage that, whether it's just stepping away for 10 minutes. I know that on my my watch, it has a thing. I can set a timer to where if it picks up my heart rate so much, it'll tell you, hey, let's just take a minute, let's slow down. It's just taking time for yourself and realizing that and knowing that your body needs a break, and that just taking some deep breaths goes a long ways. Next slide, please. So make sure you get enough sleep. We talked about stress. This is on there twice. Make sure you get enough sleep. If you don't get enough sleep, you raise your risk of high blood pressure, obesity, diabetes. Those three things can raise your risk of heart disease. And most adults need 7 to 9 hours of sleep per night. So really work on those good sleep habits. If you have sleep apnea, or you think that you may have sleep apnea, you need to follow up on that. Sleep apnea is so hard on your heart because you may not realize, you may think that you're sleeping all night, but if you are not if you have this sleep apnea where it's obstructing your airway and you're not getting a full good sleep into that deep sleep that you need to get into, your heart never gets downtime. Your heart needs that downtime to rest. And so sleep apnea is one thing. If you have a physician, a cardiologist, they probably work with you and have had you looked at. Please reach out. And if you snore, if your spouse, your loved one tells you, hey, you snore, follow up with that, because there's so many things that that negatively affects your body. So getting that sleep is very important. Making sure you don't have sleep apnea is very important. And if you do, getting the treatment for it and sleeping with that. Next slide, please. So let's talk about early heart attack care. What are the risk factors? Heart attacks have beginnings. And if you stop and think about a heart attack, 50% of the people who come in having a heart attack had warning signs in enough time that they could have gone to the doctor and had some had a workup and may have been able to head this off because they knew the risk factors and they knew what the symptoms were. So this is something that we really stress with our community now. We talk about our risk factors of chest, which, discuss with your doctor: chest pain, pressure, burning, aching, or tightness. And sometimes these may come and go. If you have a strong family history of cardiovascular disease, high blood pressure, overweight or obesity, are you seeing these? We talked about how to prevent this, but all those things that we talked about preventing are also the risk factors that we really have to watch. The sedentary lifestyle, using tobacco products, metabolic disease, diabetes, or other illnesses. And for women, it can include your birth control pills if you're within the age where you take birth control pills, a history of preeclampsia, gestational diabetes, or having a low birth weight baby. So these are your risk factors. But we got to know what to do once we start having these symptoms. Early heart attack care is about knowing what it is and acting on it. But men and women, they both present in different ways. But the main ones are, you have a feeling of fullness can be one. Pain that travels down one or both of your arms. You have jaw pain, excessive fatigue or weakness, anxiety, nausea or vomiting, back pain, shortness of breath, chest pressure, squeezing, aching, or burning. And with women, sometimes that pain can be both shoulders hurting. You can have back pain in the center of your arms, or just shortness of breath. We had a patient come in a couple of weeks ago. Her symptom was that she was just weak, and she was not with nausea and vomiting, and she was in the middle of having a heart attack. So she did right that she called an ambulance and she got here to us. So just remember, heart attacks have beginnings, and you need to realize those, and you need to act on them. And the big thing is, don't drive, call 911. Get here quick, get that help to you quick so they can get you here quick. Next slide, please. We've also partnered with with the American Heart Association. Selene has as a local sponsor to get the word out about heart attacks and strokes, and don't stay at home. There's been an alarming drop in the 911 calls fueled by COVID-19 fears. People are afraid to get out and go to the ER. They think that their risk of being exposed to COVID-19 is raised when they go to the ER. I always tell everybody, this is one of the safest places you can go, because we have so many things put in place here at Selene and at other hospitals across the state that we have made sure that our facility is safe for our patients, our employees, and their families. We have things put in place, so please don't avoid the ER out of that anxiety. I always tell them, I say, you're safer here than going to Walmart. So if you go to Walmart, but you think, oh, I'm scared to go to the hospital, rethink that. Stop and think about, what we have in place to protect you, your family, and our employees here. Don't avoid the ER out of anxiety. Don't stay silent. Don't stay at home. And if you have an emergency, call 911. When seconds count, the hospital is the safest place to be, because, heart attacks and strokes don't wait on you. And time is heart muscle. Time is that brain activity that you may save. So it's very important that you reach out and you make sure that you are being proactive in your care and not afraid to come to the hospital. I feel like I ran through that pretty fast. And I appreciate everyone listening, and I'd be glad to answer questions and talk to y'all about what we do here at Selene and what we have to offer.
You have 2 questions from the chat box. The first question is, what are the symptoms of leaking heart valves? That's the first question.
Okay.
And the second question is, how does your blood pressure change as we get older? Do you still have stroke risk if your blood pressure is normal?
Okay, so on the first question on the leaky valve, your fatigue and weakness, I saw that come up, so I wanted to make sure that I gave out the right information. So fatigue and weakness, especially when you increase your activity level, is a sign of a leaky heart valve. And shortness of breath when you exercise, or even when you lie down, is a sign of that. Swollen ankles and feet, and sometimes you will have the chest pain, discomfort and tightness, and that often increases with your exercise. You may have lightheadedness, or fainting, an irregular pulse. If you go to the doctor and they listen to your heart, you'll probably hear a heart murmur. And then sometimes you have sensations of a rapid or fluttering heart. So those are the things that you need to look for if you think you may have a leaky valve. And you can reach out to your primary care physician if you don't have an established cardiologist, and tell them, say, I have these concerns, and then they can get you worked up and get you with the cardiologist. The second question was on your blood pressure. If you have a normal blood pressure, I think we have people who in their 20s, 30s, 40s, 50s, and up that have issues with blood pressure now. That question, just 10 years ago would have been, the older you are, the more at risk you are for high blood pressure. I think as our society has gotten into an unhealthy lifestyle, with our weight, our diabetes, the things that we do, inactivity, we've created a very broad range of age groups for blood pressure. If your blood pressure is normal, you can still be at risk for stroke due to your family history. due to the amount of, if your cholesterol is high, that's something that affects that, because the same cholesterol that, we think of cholesterol in your heart arteries being clogged. Well, that's the same thing that clogs your carotid arteries or your peripheral vascular arteries. So you do it. It's very good to be proactive and have regular screenings for that, especially as you age and all. I hope that answered your question.
I apologize. You have one more question in the
Okay.
chat. If you're on a medication for high cholesterol and it brings it down, can you come off your medication?
Well, one, you never come off of a cardiology medication without consulting your cardiologist. That is first and foremost. Sometimes you can, but that would be a decision between you and your cardiologist. It would depend on your lifestyle change and everything. It's something that you need to have monitored. And I don't know, I know my husband who has high cholesterol, he has his looked at about every 6 months, and tries to do it with by just diet, but has to have the extra help of the statins. So that's a conversation to have with your cardiologist, and do not come off of it without consulting him. And once you have that conversation, this is what I'm doing, this is where we are, maybe he would be the one with you to make a decision that you two come together and decide if you could reduce or come off that medication.
One more question. Have you, Selena Memorial, seen an uptick in people actually arriving in the emergency room due to the stress of COVID-19?
We have, and I think tomorrow, one of our behavioral health director may speak more on that. But yes, we have seen an increase here at Selena Memorial on people coming in with mental health issues since COVID. I think that the stress of just the pandemic itself, and then everything that we have all seen this past 9 months or probably 6 months of bringing this on. So yes, we have. Interestingly enough, what we have also noticed is that our cardiology patients, our number of heart attacks that come in, this is nationwide, has dropped nearly 50% from what we were pre-COVID, which is very concerning. That's where we go back to that, don't die in doubt. If you're having symptoms, come to the hospital, come and let us take care of you. It is safe.
We have another question. This particular registrant says they receive mailings once or twice a year offering vascular and carotid artery screening from independent services. Do you have any advice or recommendation using different services, independent services that offer such services?
I can't speak to other independent services because I don't have experience with those to where I feel like I could speak to them appropriately. But I can tell you that when you receive those, if you are worried or have concerns that you may need to have that screening, it's best to reach out to your primary care physician and start that conversation there, because there's so many things out there that we offer here locally and that we could get taken care of. And there's a lot of hospitals that offer those for these screenings for a base rate and everything. So I would reach out to your PCP. That's my advice on these, rather than following those going out to the screenings on independent services, just because you usually have an established relationship with that primary care physician. And I think it will be a more involved and you can make decisions on your health care more easily and effectively with them.
Jeannie, I wanted to ask a question.
Okay.
This is Joyce. And, with us working more from home, sometimes we're eating more. I mean, people keep talking about the COVID pounds.
Mm-hmm.
Would you talk a little bit about, the risk to us as being overweight or obese, and what is obese to us? And then to also our BMI.
Yeah, so when we're obese and we have high BMIs, what that does is most of the time, and it's not all the time, and I'm not speaking, but a lot of the times when people are overweight, it is because we are not eating properly. We're eating those saturated fats. We're eating too high of a calorie levels, calorie counts. We aren't eating our fresh fruits and vegetables, and we tend to get. This is all of the stuff that is the perfect storm to bring in that atherosclerotic heart disease, to get your cholesterol levels up, and all. It also affects, I spoke of sleep apnea earlier. When you are overweight and we gain weight everywhere, you gain weight in your neck, that can also, if you're at risk for sleep apnea or you have it, it can make it worse. Or it can, if you've not been overweight and then you've gained weight, it can create those issues. So which in turn just has effects on down the line on all different, the way your heart works and the effects it has on your heart, in your arteries.
Thank you so very much for that outstanding presentation. There's one more question regarding sleep. If someone catches up on sleep on the weekends, does that make up for sleep problems during the week?
I have been told no, it does not, because that has been a question for me that I've asked as well. No, when you stop and think about that, we're talking about healthy sleep patterns, not healthy sleep just in the numbers, but healthy sleep patterns to where you're getting sleep every night and you're getting good, healthy sleep. So it doesn't, you can stay up, be up, and not sleep during the week, and sure, you may catch up on the weekend, but that doesn't replace a good solid sleep pattern that you can develop and get in place. I know that myself, I struggle with wanting to watch TV too much at night, and I have had to say, the TV can't be in the bedroom, because I have to be able to, because I know if I go in there at 10 o'clock to sleep, I have X amount of hours I'll get before I have to get up, and it's good, strong hours. It's 8 hours and all. But if I, make that habit of watching TV in bed at night, I might go and not get that sleep. Well, on the weekends when I try to catch up, it's not the same as just a good, solid sleep pattern. That is my answer to it. Now, that may not be the perfect medical answer to it, but that's what I've had explained to me in the past.
For those that are joining us today, if there are questions that you have for Jenny, please feel free to put those in the chat and we will make sure that she answers. So you've done a great job of talking about, those that are 20 and up, but what type of advice would you actually give for the younger children or for kids? Kids are doing a lot of online schooling today. So what recommendations would you actually give from that clinician pertaining to blood pressure or heart disease and just other medical procedures? That's the first question. But also during your PowerPoint presentation, you talked about the special recognition that Celine Memorial just received pertaining to the cath lab. Can you really go into details? Because sometimes people don't understand how such accreditation is because of the expertise that your clinical staff has. If you could share that with the general audience as well.
Sure. Well, first, let's talk about the 20 and unders, these school age kids that are doing so much from home on their school now. It goes back to good. We have to do school. You have to sit in front of the computer, but let's not forget that you need that exercise daily, just like the adults do. Let's make sure you're getting out and you're being active, walking, getting out, walking the dog, getting out, playing sports, do that. Don't let the change in how you do school and how you go to school change your activity and how much you're getting out and about. That's not just for your blood pressure or anything like that. That's for your mental health. This is tough on the young people too. This is something that a lot of them's never seen. So we really need to remember that and know that, these are hard times for them. I have a 22-year-old that plays softball in college, and you know, her season was changed. The way they did everything was changed. And all of these athletes, high school, you know, it changed the way that they get on the field and what they do and their workload. Just think what that does to these kids who are younger, and also activity is what we need to do. Get out and enjoy the outside. That gets a little harder as the weather gets colder, but on those good days, get out there and enjoy that. There's lots of stuff you can do inside besides sit in front of the TV or the computer. And then as far as the chest pain accreditation here at Slee Memorial Hospital, we applied for accreditation in October of 2019, and the American College of Cardiology was our accrediting service, and they partner with the American Heart Association to set guidelines to treat acute coronary syndrome, to treat these patients coming in with heart attacks, these patients coming in with just unstable angina, these patients coming in with just low risk chest pain. And there's guidelines out there. And this was a way that a process that we put in place to make sure that we touch every area of the acute coronary syndrome patient, from community outreach and education to the guidelines, from the time that patient comes into the door until they leave, making sure that they go outside of our door with defect-free care, that we've done everything for them to that, that speaks to those guidelines. There's so much I could go into. There's many metrics, many guidelines that we follow. We have a chest pain center committee that oversees this, and it's a work every day. As the chest pain coordinator, I follow the patient from when they come into the ED. If they are admitted, we follow through with them, making sure that we are catching and ruling them out, or if we are ruling them in and treating them appropriately. We have got risk stratifications in place, and just really, you know, we talk about, you had mentioned the chest pain accreditation in the cath lab. This is a facility-wide accreditation and process that we have put in place. And I'm just so proud of the work that this facility has done and the care that we give, not just our heart patients, but all patients. But we have really stepped up and grown this past year getting our accreditation. The big thing is, one thing that we do, and I'd like to speak to, is, you know, we talk about time as muscle. Well, when a patient comes in having a heart attack, you have the guidelines say that you should have that vessel open in 90 minutes or less. And we're at 100% of taking care of those patients. From the time they reach our door until the balloon is open, we've been at 100% for the past year. And that's a very, that just speaks to all of our departments knowing all of their piece to do and coming together and working as a team to provide that care for our heart patients. So very proud of this group.
Excellent. Ms. Joyce Taylor?
Yes. So thank you so much, Jeannie. What great information. And though our webinars were themed around senior health, you know, this is information all ages can certainly benefit from it. So if you would like to rewatch Jeannie's presentation, if you'd like to invite others to see it or to share it out to family and friends, all of our recordings this whole week are live events. We're going to be recorded and they're going to be posted on our social media next week, and that at American Heart Association-Arkansas. So we invite you to please like our Facebook page and follow us for lots of great information on Best Health, to share our webinars out to seniors, to caregivers, to anyone of any age. That again, our Facebook address is American Heart Association-Arkansas. So we all need to know about those health factors I spoke about and making sure that we're all following those for that chance of that extra 14 years. And we need to start that at a young age. There are things that we can control and there are things that we cannot control. Jeannie gave us some great advice today as to what we can do around those things that we can control. 80% of heart attack and strokes are preventable if we follow that advice. So please, everyone, put what you've learned today from Jeannie to work for your best health. And I'm going to close today by repeating some information that Jeannie shared with us on the American Heart Association and the Saline Memorial Hospital and CHI St. Vincent's Don't Die of Doubt campaign. For many historic and cultural reasons, people can be reluctant, they're afraid, or they may be unable to go to the hospital. But heart attacks and strokes don't stop for a global pandemic. Data from the CDC shows a 42% decrease in the number of people who went to the emergency room in the early days of the pandemic compared to the same time last year. In response, the American Heart Association launched Don't Die of Doubt to help address this urgent community priority nationwide and to reinforce the idea that hospitals are still the safest place to be in the event of a heart attack, of a stroke, or other health emergency. Don't Die of Doubt, it is an awareness campaign to improve trust for those that need to call 911 and improve trust in the emergency medical professionals and hospitals' quality of care. Even though Arkansas ranks 3rd in the nation for heart disease and death, even though someone has a heart attack and or stroke every 40 seconds in the US, people are delaying or avoiding emergency room visits and care. This is due to the fear of contracting COVID-19, and that fear was greater than the fear of having a heart attack or stroke. Heart attacks and strokes don't stay home. They do not wait or delay. Neither should we. We cannot afford to avoid the emergency room out of anxiety or fear. Don't die of doubt, don't stay silent, and don't stay home. If you have an emergency, do like Jeannie said. Please call 911, get treatment, get care. When seconds count, the hospital is the safest place to be. Our Don't Die of Doubt campaign is sponsored by Saline Memorial Hospital and CHI St. Vincent. We're so glad that they are sharing this with our state. For more information, you can go to heart.org/Don't Die of Doubt. I wish to remind everyone to take all precautions, to wear your mask, social distance, to wash your hands frequently. We thank everyone for attendance today. And we wish you all longer, healthier lives. And we'll see you tomorrow at noon for our next webinar with the Community Health Centers of Arkansas, Saline Memorial Hospital, and CHI St. Vincent for our senior health webinar. So thanks so much. Everyone have a great day, and we'll say goodbye now.
Thank you.
Thank you all.